Hello everyone, it's nice to meet you. My name is Gunnar Phillips. I am a third-year medical student at OSU-CHS Cherokee Nation, and today I'll be presenting this poster on behalf of my colleagues titled Associations of Clinical Personnel Characteristics and Telemedicine Practices, an Analysis of the NEHRS. So our introduction here, kind of what we wanted to get into with this study. The use of telemedicine strategies has been increasing in the U.S. for more than a decade, with physicians obviously taking advantage of this new tool in order to reach more of their patients. And kind of what we wanted to do was we wanted to determine the specific demographics of the physicians using telemedicine most in their practice, so that it could inform recommendations for the future for expanded telemedicine use amongst all physicians, and in doing so that could aid in mitigating the need for physicians currently felt by both our urban and rural populations. So our research question was to assess the use of telemedicine by physicians in the year 2021 based on 4 demographics that we extracted from the NEHRS. So those 4 demographics that we extracted to look at telemedicine use were physician age, sex, specialty, and training. And then moving on to our methods section, so with that data set, the NEHRS data set, using those demographics that I just mentioned, we performed a cross-sectional study to determine the relationship between those physician characteristics and telemedicine practices. So physician demographics that we extracted from the NEHRS included physician age, which we actually ended up simplifying to just greater than age 50 and less than age 50, sex, male or female, field, primary care, which included physicians reporting as family medicine, internal medicine, pediatrics, and obstetrics, surgical specialties, which included general surgery, plastic surgery, and ENT, as well as medical specialties, which obviously there are many, but this included addiction medicine, gastroenterology, nephrology, amongst many others. And then we also looked at type of training, so DO versus MD. And then differences between these groups were measured via design-based chi-square tests to give us our results, which we have right here. So our results section, we found that female physicians are more likely than male physicians to use telemedicine services practice, as well as that physicians under the age of 50 are more likely than physicians over the age of 50 to use telemedicine services in practice. And also, our last significant finding was that physicians in primary care and medical specialties had higher rates of telemedicine use in practice compared to those in surgical specialties. And then we found no difference in telemedicine use in practice based on type of physician degree, MD versus DO. And that's kind of outlined here in this table, physician demographics by telemedicine use. You can see our significant values bolded there on the right, kind of walking you through what I just said, how female physicians under the age of 50, and primary care and medical specialties are all more likely to use telemedicine services in practice. And then our conclusion, so our results did show statistically significant differences between physicians' age, sex, and specialty on telemedicine use in practice in 2021, and efforts to increase this telemedicine use among physicians who employ it less may be needed in the future to provide more accessible care to patients. And then that kind of piggybacks off into the significance of our findings, which kind of shows us that high rates of telemedicine usage among physicians, especially those in family medicine in the primary care category, regardless of type of medical training, which aligns with many current patients' preferences for telemedicine services. So one of the things we found in our study was that many patients today currently are wanting their physicians to employ telemedicine services in their practice. And simplifying that telehealth technology, tailoring options available to physicians, and providing training in this telehealth technology may help those physicians who are male or over the age of 50 more frequently engage patients through the use of this telemedicine. And then that in turn can obviously increase healthcare services provided to rural areas, federally designated health professional shortage areas, and medically underserved populations who rely on these telehealth services as a means for accessing care to clinicians. And that's it. I want to thank you guys for listening to my presentation. I appreciate it. Have a good day.